One of the things I enjoy most about doing neurofeedback is the knowledge that I'm making changes every time an individual comes in. Working with people is different than being like a carpenter or something like that. At the end of the day, the carpenter can look and see what he accomplished and know that something has occurred. Working with people, it's hard for us to see inside them and to know, well, how are they doing? Are they really making progress, or are they going backwards, or what's happening? So what we do with the neurofeedback is that at the beginning of treatment, we have the individuals take a sheet of paper that you'll see here, and we have them write down whatever goals they want to work on. Now, it doesn't matter to the computer, who's doing the neurofeedback, what the diagnosis is, if this child is attention deficit disorder or not. We're working mainly on functional behavior. So we look at behavioral tasks. Less impulsivity, better attention, regulation of moods, things like that. But we let the parents decide for the children what goals they have that they want to work on, and for the adults they write down whatever goals they have. So at the beginning of treatment, generally it's rated from 0 to 10, so it starts out with 0s, 1s, 2s, 3s, wherever they're at, and then as treatment progresses, we gradually see changes taking place, and every week we have the parents monitor that. So I'm going to just go over a few cases with you so that you can see, in a sense, more like real live testimonies of what's happened with people who we've worked with. So I'm going to start with one of my favorites, a little 5-year-old boy, extremely gifted, wonderful, full of energy, full of life, but too full of it. When the first time he came in, he would run around the office, running into every room that he could, and trying to get us to chase him. The next couple of visits, he was hiding under chairs in the waiting room, just kind of being out of control. He's an only child, gave his mother a real run for her money, and the teacher at school was very exasperated with him as well. And so you can see on his sheet that he started out with 0s, 1s, 2s, but started making changes rather quickly, and after about 5 months he was up to almost all 8s. So extreme improvement from the beginning. I had a 7-year-old girl who also was very bright but very ADD. She couldn't keep quiet. Her mouth was always moving, always talking. When she came in, she was singing to herself, making noises, always asking questions that were off task, and doing things that were inappropriate. And again, you can see the changes with her. She started out at 1s, 3s, 4s, and then pretty soon, after about 4 or 5 months, she was up to 6s, 7s, and 8s. And again, it's just rewarding for me to know that these changes are taking place. Next, we have a 12-year-old, and this again was just a typical, ADHD boy. There's 2 types of ADHD. One is the inattentive type, and these are kids who have a lot of the slow brainwave activity, but it doesn't bother them, and they kind of just go through life in a dream world, not really excited or upset about too much. And then you have the hyperactive type of ADHD, and these are kids that can't sit still, so they're always rocking, moving, tapping, doing something to stimulate themselves to speed up their brainwave patterns. And this is where you'll see a lot of these kids, once they become teenagers, they start drinking the Mountain Dew, smoking cigarettes, trying other chemicals to try to boost up their arousal system, get their brain working faster, because they don't like those slow brain waves. So with this boy, again, his mother brought him in. We do work with the parents in a parenting program as well as working with the child in the neurofeedback. So we're not expecting the neurofeedback to do everything, to be a total cure-all. We do some talk therapy, and we do some family therapy, and try to work with the whole system, get the teachers involved. But again, you'll see here that from 0s, 1s, 2s, 3s, within about 4 months, he's up to 7, 8s, and 9s. And so it's just very rewarding for us to see these kinds of changes. Next is a woman who came in with extreme anxiety. So she was referred by one of her therapists, and lovely lady, but just had a lot of difficulty with emotional issues. And again, you can see the changes just started moving in the right direction, and she's a much happier, more content individual. And then the next is a 44-year-old male who had concussion, NFL syndrome, had several brain concussions, and again, you can see the nice changes that took place with him. I should mention, many people ask, is it okay if I'm on medication? Can I still come in and do the neurofeedback? And the answer is yes. So if you or your child is on medication, that's okay, and they can come in on the medication. And then as their brain starts improving, then the medication can be decreased. So we can kind of work on getting people off of their medication as they start seeing positive results. So those are just a few of the examples of what happens when we work with people. And again, think about your goals, what you want to work on, and let us know how we can help you, and we'll look forward to seeing some wonderful changes in your life as well. Thank you.